Welcome once more to the Radio Voice of Oslo, and to our viewers and listeners. It's amazing and lovely to be back once more. Today with me, it's Dixon. Dixon will introduce himself, but I will also say, like, we're talking about the aftermath of the pandemic, corona. It's not yet finished yet, but at least looking from when it started up to now, there is a way we have gone and maybe a little bit of conclusions we can make from this. So Dixon, welcome, and sorry guys, Dixon will not appear so much because of technical issues, so he will be on the background in the camera. Welcome, Dixon.
Thank you so much, ladies and gentlemen, those who are hearing us from all over the world. My name is Omolo Dixon. I'm an expert in adolescent and youth issues in relations to health and education. I welcome you all.
Thank you. Dixon, could you just tell us also a little bit of your organization and how you work?
I work with an organization called STIPA. STIPA in full stands for Support Tropical Initiative in Poverty Alleviation. STIPA, we have a project called Community-Based Health Insurance as our main project. Under Community-Based Health Insurance, we have different components like livelihood, we have adolescent, safe motherhood, and mostly agriculture and health issues that we work with. So that's exactly a little bit background of STIPA. We are in community-based national, we are non-governmental organization working in Kenya, around the Western region part of it.
Okay, thank you. What do you make of the pandemic as per today, so far?
So far, what I can say about the pandemic, the COVID-19 pandemic disrupted every aspect of people's lives and unpredetermined manner. While many of its implications, such as related psychological distress and social distance measures, affected all of our society and mostly the youth. Different ages experience this impact in distinct way. Very distinct way. Now, for example, transition of government response from immediately crisis management of the implemented issues recovery measures. This emerging such as high increased level of youth unemployment and impact of rising debt for issues intergenerational justice, as well as threats of being threats to the well-being of youths and future generation. What I'm trying to say is that because in Kenya there's high rate of youth unemployment, and then the pandemic comes in, it means that now it made the youths to be in a linker position, because now the futures were unknown. Another, as we continue going down, this pandemic and evidence demonstrate that this pandemic has hit vulnerable groups. And vulnerable groups, that is, I can take the age of 15 to 24 across the whole cohorts. The issue that affected this, like, for example, the research which was done, like 2.5, this generation, about 2.5 times more likely were the employment of 25 to 26. It means that there were unemployment issues when rise. And this has affected most of us as a youth, because now it means that now, for example, the youths who are vulnerable in terms of maybe physical disability and socio-economic disadvantage were more than previously before the pandemic. And this placed the government in a very difficult position. Because now, as our president, the president was very much passionate, because now there was a lockdown, there was issue about social distance, and then it raised the issue about the loss of jobs. So the country was very much affected. The things that maybe the president touched on, which were very much important around us, and I really applaud the president for these measures. For example, the president put 100% tax relief on Kenyan earning between 24,000 and below. And 24,000 and below, we might find that these are the ratios of the youth. And then another issue that the president put across was pay as you earn reduction from minimum of 35% to 25%. reduction of tax turnover rate by 3% to 1% for all micro, small, and medium enterprises. Look, these are the areas mostly the youth are working in. Then there was a reduction of resident income tax by 20%, making available 10 billion Kenya shillings. That is that is 95 million US dollars to vulnerable groups, including the elderly, the orphans, and many among others. These are the money that, at least now that we speak, there was the president came up with another with an Kazi Mtaani initiative for the youth, which now we realized that when there was an issue about lockdown, the youth were very much vulnerable. So he brought this Kazi Mtaani so that the youth can have something to survive with this during this pandemic. And then there's a temporary suspension of listed loans defaulters for any persons of micro small businesses. So I love this because most of this particular time, loans were being borrowed because they were hard and tough times. So there was a suspension among the defaulters who mostly, according to, there was a caption that 25 billions, there was a loan that most of the youth were mostly going to. There was a 25 billions borrowing of the youth. So when we saw that the president took a suspension among the defaulters, it was a relief for us and the youth that were working it. And then another area that the president touched on was the reduction of the VAT from 16% to 14%, which was very much effective. As I continue forth, the economic and health impact on the COVID-19 have been systematically across the ages. That is according to World Health Organization. It was systematically because it affected the young people in a very, very hard way. Now, being unemployed at a young age can have a long-lasting impact on a youth. Why? Because number one, when a youth is now starting to think about the career, because people saying that the 2020 calendar affected them. So what they were trying to say that now, when this calendar affected them, it was like this year was not there. So it means that their future is unknown because their future has been stagnated at some point. We can talk about the young people, the age 18 to 25, who are now living under poverty. What will they say? Because now the effect are trying to affect now their mental health. As I always know, young people have history of unemployment faced by the career development opportunities. So once they're the same people affected by the employment, and then the pandemic hits, it means they are affected mentally, psychologically, and then economically, because young people have also limited financial access. But now again, which puts living economically vulnerable housing. For example, these youths were financially affected, and now the pandemic comes. It means their households are being affected more and more. Like, for example, the 3 months period since the pandemic started, the poverty index has risen. Now, the government tried. That's why I talked about the issue about the Kazi Mtaani came in. But now, despite the fact there's Kazi Mtaani, we have a loan that Kenyan government always gives to the student. It was a Kenyan, it was a loan, school fees loan for the students who are in university. They were not able to pay the loan despite the fact that the Kazi Mtaani was affordable. As I go forward, Kenya launched a participating initiative that engaged Kenyan citizens on the COVID response recovery efforts. Now, like for example, there were a multi-sectorial initiative that came together for this pandemic to help the youths in terms of employment and mental, because they're being affected mentally. Maybe I can talk later on what and the impact and the vulnerability that affected the youths later.
Okay.
Maybe. Yes.
Okay, I'll just cut you a little bit short. So I will just explain a little bit to our viewers and listeners that we're sending both effects of pandemic, both in Kenya and worldwide. I'll talk a little bit about how it has affected people in Norway, but at least you'll be doing mostly worldwide and in Kenya. Now you've talked more about Kenya. So how do you think the pandemic has affected it worldwide? Just in a nutshell.
In worldwide, maybe just to pick something to do with worldwide, this pandemic, as we say, it was not anticipated. And worldwide, most of the youth were having an opportunity. There was this cross experiences sharing. Now that was locked them in terms of the planes were not moving from one country to the other. So it means there was not that interaction part of it affecting, as I go maybe to the youths, because as I look, there were many conferences, many meetings from different countries on youth sharing experiences. So that was affected mostly. Then another thing, most of the youth here have an entrepreneurship ideas. So once now it affected the economy because they were expecting that when the whole world has opened up, they can have different ideas, opportunity to explore for those people coming in and outside the country, affecting the whole world in terms of financial. Maybe to bring a little bit statistics that I saw that were really shocking about the world. It was really scaring about the world, how it was affecting people around the world. Just a little bit to see the statistics. According to World Health Organization, let me use World Health Organization. It says this, that this pandemic, the World Health Organization defined this pandemic as the greatest challenge that ever since the World War II. And this means that no one has expected it because, number one, we see that the countries race in slowdown of spreading of the disease by trying to test each patient coming in and outside the country. And now this affected the world in for example, the following ways. There was limited travel, there was quarantining of citizens, cancelling of large gathering such as sporting events, concert, and school. Moving these waves that made that all these things were not happening. The sports, the schooling, and the concert, and these are the areas that most of the youth are venturing in. And this pandemic, as I can say, this pandemic was one of unexpected. As I said, it's one of unexpected. Now, there were another thing that happened in the world. There was closing of the shops, the theaters, the restaurants, the bars. Every people lost their jobs and income in a very great way. According to what they was trying to say, the loss of jobs, International Labor Organization said this, that 25 million jobs got lost. Once 25 million jobs got lost, it means that people were affected both mentally, physically, and emotionally. That's what I can say about the worldwide.
Okay, thank you. Moving forward, are there some plans or activities now that we have seen the effects of corona? It has kind of shaken the whole normal way of doing activities and everything. You work with youths, and I know you are in Kenya, but your organization is German-based, right? So both in Kenya and in a general way, do you think that there are some specific activities that can be fitting for both the youths or maybe the society as well, so that even if the corona or such a pandemic hits, then there's still some activities that still can be done?
Let me give an example of what UNICEF came with. UNICEF was trying to come up with a hashtag called Reimagine the Future that we want after the pandemic. It gave an example of a generation with unlimited innovative challenge, where this particular what I love, the way forward that I love. Now, it made people to rethink For example, there was this particular, what people are trying to do is they were trying to use the waste material, the plastic, the glasses, the rubber, and came up with the new ideas on how they can work. What they were trying to do is now, it means that it is not only we wait for the pandemic for us to rethink, for us to reimagine. There are a lot of things that we
mm,
can do out of this pandemic. What I love what UNICEF tried to come up with. Why? Because once the youth are trying to think on how they can come up and the economic wise, in terms of, they were trying to talk about the minds. How can we
mm,
renew our minds in these particular harsh times? Number one, how can we involve ourselves in economic activities that can still help
mm,
us in terms of the financial. Then number three, how can we protect ourselves in terms of the health?
mm,
So these three areas, and then I can add in terms of education,
mm,
that in terms of education, how can we reinvent education? Because us in Kenya, what we always knew is for us to access education, there must be school.
yeah.
For us to access health, we also have to go to the hospital. For us to
Mm,
have, for us to go for us to have jobs, we have to find offices, or we have to find industries. For
mhm,
us to have ideas, you must again go to school. So once this pandemic, the way forward is what we come to discover is that there is internet has really tried to open up our minds to have a lot of ideas. Because let me use in terms of education, our school
mm,
lost like 4 weeks in these
mhm,
education times. So these 4 weeks, but the fact school have reopened, we have found that there are all ideas that we can work with for whole weeks because of the Zoom, the webcam in these particular times.
yeah. Oh, okay. I can also like chip in a little bit there. I know in developed worlds, like in Norway, online schooling has been going on as usual, and it's like the effects are not felt as much as is it in Kenya, or and developing worlds, whereby internet is just a luxury. For families or households to even get that access to the internet when food is still not even on the table. And then also the other thing, like even the nature, the environment, and everything, it has affected a lot of things. But then there's a difference when you're talking. There's difference when you're talking on developed world and then undeveloped world. But I know every society has their own ways of fixing things and making ends to meet. So thank you for bringing that one of Kenya. And also we know what is happening in the developed world. But moving forward, I know we have learned a lot. Inventions have come. We have seen like everything can happen. Like the world has become like a global village whereby online, just the tap or like touch of a mouse or something like that, then you can connect to anyone worldwide. So that was some of the positive things that has come with the corona pandemic. Moving forward, is there any better way for us to get prepared if such a pandemic hits the world again? Let's say, like maybe Corona finishes, and next year, for example, another pandemic that is probably worse than Corona comes. Is there any way we can prepare ourselves better than what we have done today or now?
I can tackle that in the following ways. Number one, flexibility and adaptability.
Mm,
Now, at least the way forward, we have come to learn that you have to be flexible. Despite the fact that we can have planned, that
mm,
we can have planned budget or planned activity. It will reach a
mm,
time when there's a pandemic breakout. There's
mm,
a way that we have to follow. So we have to know that we have to be flexible with our
mm,
plans, with our activity, with our budget when
mm,
a crisis hits.
mm.
That's what number one thing we have learned. Number two is digital. How-
Digitalization. Mm,
Yes, that now that there's something to do with the digital platform,
mm,
things to do with the digital platform, are we able to come up with ideas
mm,
that are digitized Like, for example, now you knew that there was issue about the social distance, which has closed the borders. There was issue about sanitization that people now, some people have to use, must have to use the protective, the PPE materials. So at least we are now engaged in technology where we do there's no necessity of now having meetings, one-on-one meetings. That it is now, now, for example, digitalization in terms of, if it is a term economic, that we can buy things online, we can access health advices online, we can access education online. So these are the kind of way forward that we have learned, that even if in Kenya we have season of schools, that even if schools close, that even if you cannot access a hospital, there's a way that you can all able to access these particular services. Another thing is, I call it plan B. We should always have plan B. What do you mean plan B? That now a pandemic has hit. Where the plan that you're having initially, can we tailor make the plan to fit the exact current situation that you're having? Like, for example, there's been evident issue about rethinking and reproducing things like masks, Facebook, and sanitizers. For example, can this make us able to know that when it comes to this particular pandemic, can we able to have a plan B? Like, for example, in Kenya, we had to outsource of this particular thing. We have to buy all these particular PPE materials. Do you have a plan B that in case it happens and the world have closed down and now it has found us barefooted, are we able to make or produce this kind of materials without having help from other countries? Then another thing that we come to realize is partnership is a key. That's my fourth point. Partnership is a key. I love how the government and the government, the public and private, the PP public and private partnership, I call the PP public private partnership, has helped in terms of mitigating the coronavirus pandemic. How they came together, produce IC materials with different languages, with different kind of instruction, with different kind of prevention, promoting and preventive measures around. Because I love how UNICEF, I love how the national government and the county government came together to fight this pandemic. Another one is build more mental strength. Why? Because what you come to life skill is a key. No one anticipated such kind of a pandemic. So once we have life skills on teaching people on mental health, because people are affected mentally, no one appreciated the lockdown. No one appreciated the social distance. No one liked the mask thing. No one was ready to adhere to hygiene materials instruction. So it is better that we have a mental strengthening areas or mental strengthening programs that can able to help us, or that can be set aside, that if this such pandemic hits, we just roll them out instead of now waiting for partnership, instead of us waiting for digitalization people. But now when these people are already on the ground and working together, it's going to make us easy to fight this pandemic. And that is the way forward that I see it can work for our country and the rest of the world.
Okay, thank you. And I know, like you've mentioned, or maybe slightly talked about authorities. I think one of the things that we have learned is, especially in this part of the world, is it's very important to follow authorities. And when a pandemic strikes like this, in some countries it's difficult, especially if the trust on the authority is very minimal. But in countries that are developed, where probably you can depend on your government, it's better, because at least they have done research, they are running research currently, they at least have some clue of what needs to be done. Like, for example, this hygiene thing. From nowhere, people had to change their hygiene strategies, how you wash your hands, how you clean everything, how you even handle your face, so those are some of the directives from the government. So I think that is one of the things that you have learned, like if it's a system that is functional, then it's better to follow it and respect it. Most of the infections, for example, that came from these places is especially the new or the current infections, is whereby people don't follow instructions. They have big gatherings, like big weddings, and some of those things. So at least that is some of the. So those are some of the things we have learned. And talking on the general effects, both positive and negative, as we are closing, and then as you'll be giving your final words. I know you've mentioned them in passing, but as you close, anything positive, maybe 2 points, and anything negative. I know a lot of negatives anyway, but anything positive with this pandemic.
Uh,
Just two.
posi- Positive. What I love,
Mm,
the positive that I can talk about that I've really noticed about this pandemic is the importance of partnerships.
okay.
Because I've come to realize that even if it were not for the partnership between the collaboration with different government agencies and different private entities, it could not have worked. And this particular partnership have brought ideas,
Mm,
or very good ideas in terms of utilization of internet, that
mhm.
things can work with internet. And another thing is that now the youth had an opportunity to renew their mind and come up with better ideas to work out in the generation. At least now there was no one to tell the youth that come up this idea. There was no one to sit with them down because social distancing and things were happening. So it brought people that when you are in isolation, when someone now has a meeting, we call it meeting with yourself, with your mind, your body, your soul, everything in you. At least they sat down and came up with the different kind of apps that can help us fight this pandemic. Another kind of positive thing that we saw about this pandemic is the hygiene factor that we're talking about. No
Okay.
one had to follow up a person in terms of the hygiene. There was a self-discipline in in every person's concerning on how we can fight this pandemic.
Okay. Thank you. Thank you. So I've learned like this partnership, there is invention, there's internet, and then there is hygiene. Thank you, Dixon. And it's been nice to have you guys. And you guys are doing a great job. Personally, I learn a lot from your organization and how you work with youths. And the fact that you are an international based organization and you do your research internationally. You're based in Kenya, but your research and everything is international based, so it's quite helping to juggle minds around, especially with youth, because grown-ups, maybe they've already identified what they want in life, but youth, especially this particular moment, we realize, like most developing countries, a lot of youths are being pregnant, a lot of youths are getting out of school, a lot of youth, I mean, there's a lot getting into criminal cases, and just into drugs. So you guys are doing a great job. And up to next time, thank you, our viewers. Thank you, our listeners. We're still on to this pandemic, but we are positive that when we're done with it, we'll come out stronger. Thank you, and bye for now.